Hey everyone, welcome back to my channel, and if you are new here, I interview the brightest minds of physical therapy. So if you want to be a successful therapist and increase your knowledge, start right now by subscribing to this channel, give us a thumbs up, clicking on the bell so you don't miss anything, and share this video with your friends. Today, our guest is Joanna Haymore, and she has tons of experience with body-mind centering and CranioSacral therapy. She's going to talk about healing from the core and much more. I hope you enjoy the show. Hi, Joanna. Welcome to PT Pro Talk. How are you today?
I'm good this morning. Thanks a lot for asking. How about you?
I'm good. I'm great. Excited for our conversation today.
Me too.
Okay, so could you tell us a little bit about yourself, your career, and how did you get to where you are right now?
Well, I began my career in healthcare as a massage therapist, and that kind of happened by, I don't know, I guess the word sometimes is synchronicity. I was working in a courtyard painting a kiosk for a business, and I put my knee down on an errantly placed razor blade, cutting my knee significantly. And I limped over to a bench in the courtyard and sat down beside the closest place to sit down, and this lovely woman was on the bench with her friend. Her name was Sonny Hamilton, and she had just moved into town. She was a structural integration practitioner. This was back in the early 80s. In Chapel Hill, North Carolina, and she and her partner had just moved into town to begin a massage training program. So she was so kind. She took me to the hospital. We got stitches. She took me back to my friend's house, and then proceeded. And I had maybe one massage session in my life before that. Didn't really know that much about it. And she proceeded to really work with the soft tissues. All the way down and work on the swelling, all the way down, like right up to the layer of the stitches. And I just recovered absolutely beautifully with no pain to speak of and or swelling. And I was hooked. I went on to study with them and get my training as a massage therapist. And that went on until, that was in 1986. Then I ran into a group of people called Bonnie Bainbridge Cohen and her training group called Body Mind Centering up in Amherst, Massachusetts, and was immediately engaged with Bonnie in a 4-year training program that for me was really beyond massage. It was the practice of embodiment. She was a dancer, a healer, an occupational therapist who had studied with the BOBAS, which is the neurodevelopmental folks that are so big in PT, I guess. I mean, I'm sure if that's still a big name in physical therapy, but it certainly was back in the 80s when I met Bonnie. And that work really involves around like relearning through normal movement patterns how to help the body when it's encountered neurological dysfunctions. So Bonnie was really a master, and we spent I was one of the first really big training programs. There were 100 of us, international students, about a third of them, who gathered in a basement of a church in Amherst, Massachusetts. And we spent 6 weeks for 4 summers in depth in embodiment practices of touch and movement and repatterning consciousness of each and all of those systems. Like you would spend a week on palpating all the different muscles of the body, from origins to insertions, and what it was like to move and experience moving from that system. And then the next week we'd switch over and do organs, and then the next week we'd switch over and do the nervous system and all the developmental movement patterns. So that's an amazing program that is actually still ongoing. And in the world of where everything has become so online, Bonnie herself is now actually really available on YouTube. Lots of amazing short videos of embodiment practices. So it's a pleasure to have had those experiences in bringing me really out of my sort of rural North Carolina roots not ever dreaming there was anything that existed in this world of healthcare. So I feel like I've been really fortunate with all the teachers, including leading up to Dr. John Upledger and Suzanne Skrlock.
Nice. So how did you start your interest in craniosacral therapy?
CranioSacral with Dr. John was, again, via a friend, right? Somebody who had actually studied with him in his early days up in Michigan State when he was doing the research for those first 2 books. And when the first class came to Chapel Hill, I think it was in 1989, I was on board for it. And then for, I guess, at that point, I had been inspired for continuing my education as an OT, because Bonnie, the OT, was a master at really working with children with lots of really advanced neurological problems and helping them find, function in their movement and in their relationships. And so I didn't feel like as a massage therapist I would have that kind of access, so I wanted to go to OT school. So I spent 6 years kind of working with my clients and going to OT school, getting ready and going, and didn't take another cranial class for a whole 6 years, just using those first basic 10-step protocols. And then in 95 or 96, I went back for I was lucky enough to work for a pediatric OT clinic in sensory integration. And my director, Linda King Thomas, was interested in craniosacral therapy. So a group of us went down together to take the 2nd level course. And I met Suzanne Skrlock, taught that class, and I have been sort of in depth moving into it, finally getting my diplomat certification just a few years ago, just because I wanted to continue to teach for the Upledger Institute.
Interesting story. So I'm just asking here the similarities about the course that you did before the craniosacral and the craniosacral. So how that works, because I know that you talk a lot about the embodiment of healing, and you mentioned that before. So how is the connection? Like, what did they have in similar, and what is different from both of them that you just mentioned?
I think you have to kind of take Dr. Upledger and his whole approach with neutral presence kind of in the context of the time, right? And so a lot of this work kind of like leapt off the shoulders of some of the pioneers that started back in the 1950s, like Thomas Hanna, who was one of the first sort of, body worker people to coin the term soma or somatic, meaning the lived body experience. Well, so I think Bonnie, both as a dancer, of course, had an innate awareness of her personal internal experience as being a really important part of that expression. One of her famous lines is that the mind, our thinking, is expressed and by the body in its movement. And so she takes that into incredible depth in all the different body systems. Dr. John, with his neutral presence, I mean, he has like 4 really primary tenets in the neutral presence theory, which he and Bonnie share. There's a lot of similarities in terms of how the huge pioneering picture of how body, mind, and spirit are intimately woven into our cellular experience, into our biology, into how our body functions. It's all woven as one. They share that greatly in common, right? The Upledger system developed under Dr. John's tutelage as a hands-on system, a touch system. And we'll talk more about like how his neutral presence has developed over time with Suzanne Skrlock to be this avenue of therapeutic presence. And that's what a course that I teach called Deepening Your Craniosacral Presence is about, is how you yourself need to embody that feeling or that felt sense within oneself in order to engage in the subtle layers and the subtleties that are possible to experience and to kind of like co-regulate with the client, right? So that work leads us, down the rabbit hole into Porges and his polyvagal, but we'll save that for later. But Dr. John's work and Bonnie's work were sort of different in that Dr. John wasn't, quote, a dancer, a movement kind of person. So Bonnie took the work in terms of how the body grows its three-dimensional qualities in movement, as well as in the touch field. Our movement, in dance, in voice, there's just so many aspects to the body-mind centering program. And then the Upledger system has focused a lot. And on all the many different variations that now exist, that didn't exist in the beginning, right? Like other people have jumped on and created amazing courses, like Tad Van Leer's glial cells and the extracellular matrix, which we're going to talk about. And another that I did recently, which we may not have time to talk about at all, which was the CranioSacral in the immune system, which is certainly really pertinent to today. Right?
Yeah.
So there are similarities and there are differences.
Okay. So since we are talking about Dr. Upledger's neutral presence, so could you tell us a little bit about that and listening to the body tissues and the person's inner wisdom and the craniosacral rhythm with the layers and all of that?
Sure. I mean, it's a vast topic, but we'll do what we can today, right? So as I said before, Dr. John had like sort of 4 different avenues that everybody would come to recognize. He was just a natural. He just did what he did, and magic kind of happened. People healed, and he had this presence that he had no name for. It was just him. But coming after him, people had to kind of give language for what it all was. So my summary of it is that, like I said before, that there's that immediate recognition of the body, mind, and spirit of a person as self-healing. Like the whole, if you use a homeostasis, but homeostasis doesn't quite cover it, and that the role of the therapist in Dr. John's work is a neutral facilitator, meaning there's this quality of listening and responding to the craniosacral rhythm, which of course he identified by its symmetry, like is it equal side to side, by its qualities, is it smooth, is it effortless, is it struggling or rigidy in some way, by its amplitude, like how big does it get in this internal system, or how fast does it move. That was one of his proposals. And then the other thing that was so important about his neutral presence is he had and taught and demonstrated the ability to follow by trusting that the client's body, he called it the inner wisdom, or that the client's body and the tissue fully understands the history, the problem, and the resources necessary to bring about more harmony, more resilience, and less conflict within the system. And it's a very different model than find the problem and identify it and specifically work on the problem. So it's a totally different paradigm. And then the other quality that he really kind of hammered into all of his students over the many years was that listening hands, non-invasive touch with the least possible force to meet the body is the support that moves the body towards its self-healing or self-correction. Those were his, primary things, but easy to say, but easy to say we're going to be absolutely neutral, simply neutral, but it's really complex doing that. It is not easy to just be present, to listen and attend while trying to limit our ability or our natural impulse to go in and direct, find the problem, and with our intention, our energy, our dialogue, fix it, right?
Simple.
Yeah, it's just
Super
really
simple.
Just be. But it's not so simple.
No,
And,
it's not.
it's not, and particularly, in the realm of, I have the luxury of private practice here, so I can spend time and allow these things to unfold. And I get a lot of students in the class that we teach, deepening, developing and deepening the craniosacral presence, where, you'll have massage therapists or PTs, who are coming in, who are in pretty fast-paced practices, particularly, right? And they come in and they're exhausted and really burnt out from the demands that don't allow time and or energy to include me, the person, and what I bring as me, the person, into the session on a daily basis. But Dr. John's model and the model of Suzanne Skrlak is that, and the model of Stephen Porges that we're going to talk about in terms of the social engagement and how healing happens better when the therapist is embodied oneself, and that creates a sort of trust and safety in the client's body, that the actual skeletal muscles in the nervous system respond very differently when the person feels engaged and safe. Rally ideas for this idea that the therapist really needs this quality of therapeutic presence or embodiment in order to actually do an effective job.
Which is not possible in our normal big companies models.
The time is the issue, but in this, we can just sort of maybe jump in and talk about the developing and deepening your craniosacral presence curriculum.
Yeah.
Within the Upledger system, it's taught. But then there is a new wing of it that has kind of emerged in relationship to really the limits of hands-on practice that a lot of people have experienced with COVID, right? So healing from the core is now evolving into a distance healing from the core comprehensive training program I know, to develop this quality. It's sort of a weird conundrum.
How do you do that?
Yeah. Well, I will give you resources on how to contact. We have shown that it is quite possible to teach this via distance. The first course is like 6 days, and I think it's called Distance Healing from the Core, the 5-pillar method. So you really spend the first 3 days with the material that we do. I think it's 6 afternoons with the material that we teach in the developing and deepening your craniosacral presence. And then it's that embodiment piece that is so vital to, being able to, one, listen to the subtle layers in tissue that you actually, believe it or not, can work with from a distance if necessary. Of course, with the hands-on work, it has another quality, which we all love and appreciate. But we're adapting to the world that we're living in.
Everybody has to adapt, so
that's what we're doing. Right?
Yeah.
That is what we're doing with that. By the way, there are a couple of really good books from Suzanne's, which I'm going to give your readers, is Full Body Presence. And you may have actually talked to one of my colleagues earlier. So, Full Body Presence and Reclaiming Your Body are those 2 books by Suzanne.
Good. I'm going to make sure to put on the show notes so everybody can access.
And the website is pretty comprehensive, so there's a lot of information there.
Nice.
Yeah.
Do you want to talk something else about the embodiment and healing from the core that you were talking about, Suzanne, and the developing and deepening your craniosacral presence?
Yeah, can I add, as we go into that, a little bit from how that work draws on the work of Stephen Porges?
Yeah, sure.
And the polyvagal theory, because I think it's really intimately tied in. Porges is a psychiatrist, and you're familiar with do you know, is the polyvagal theory familiar for you? Is that a familiar language at this point?
I don't think so. Maybe if you give me a hint, I'll get it.
Okay, all right. I just wanted to know kind of where I'm starting here.
Yeah.
Well, it's a neurobiological model of how our social, it's also like the most evolutionary advanced part of how the human brain makes relationship and feels and what happens. And the cranial nerves involved in the polyvagal theory that keep us engaged in relationship are, and I wrote them down so my tongue wouldn't get tied up. They're the vagus nerve, right? And it's particularly the newest layer of it called the ventral vagal nerve, and the trigeminal nerve, which of course goes to all the, the upper part of the head. The facial nerve, which is all about our expressions, right? And then the glossopharyngeal, that's the ninth one, which is all about the tongue and the throat. So it's all that intonation and language that we are all so highly attuned to. The tone, literally the tone of voice and expression is all tied into this ability, or how we know we're safe. A lot of times is indicative of somebody's tone, right? And their facial expressions, and then the accessory nerve, which goes to the upper traps and these muscles here, which is the rotation, the tilting, the flexion. So like body language. So we're so biologically wired to innately respond to these signals as it's safe for me in this person's presence, or it's not safe for me in this person's presence. In the Porges model, when this system is engaged, literally, like open and active, and we have access to our curiosity, we have access to our sort of more of our body awareness, and more of a sense of sort of well-being or trust. Conditions for optimal healing. So that's kind of the neurobiological foundation that healing from the core work is laid on top of. Because you can know that in theory, but what good does it do you if you don't know how to do it?
Yeah.
Like, and how to engage it when you show up at your therapeutic clinic in the morning and your kid was up, throwing up all night, and you've got a blazing headache. Okay? Like, how do I get back to that place where my clients are going to feel safe today because I don't feel good, or I'm exhausted, I would rather go lie down and take a very long extended vacation than be at work today. Right?
Yeah, it's a challenge for sure, because everybody has their own bad days. You're not always feeling good, but you have to try to provide that to your client, right? To have a treatment and result. So I bet that's quite challenging.
It is quite challenging. And then, and then that's just the daily. Then you deal with that person, the therapist's own history of feeling safety in relationship, right? I mean, you've got a long history, a channel there of like, how are they comfortable? Do they need to hold rigid, tight boundaries and be the expert? Right? So it really feels so, I guess the embodiment piece here is, it feels when people first have this experience of being met by somebody who's safe and grounded and really, like, if you can hear me, I'm sort of settling back into my own backbone here a little bit, and the tone of my voice shifted. Did you notice that?
Yeah.
Yeah. So that was a conscious choice. I realized, in coming out to talk to you, I'm kind of more out here, right? But if the minute that I go, oh, right, I need to listen and allow myself to be a presence, I literally just go, okay, got it. I know how to do this. I just find the three dimensions of myself in that conscious awareness.
You have to know when to shift your behavior, your how you act.
Yeah, your awareness.
Yeah.
where you take your awareness is where your consciousness goes. I mean, that was one piece I learned from Bonnie Cohen in the 80s, right? And so it's just continued throughout the evolution of like this whole therapeutic presence and embodiment, you know.
And I bet that that would require a lot of therapists to seek treatment to themselves too, so like they feel good about it. I don't know. I would imagine something like that.
Well, self-care, do you know? Like finding the avenues to create the self-care and take it and you know, and then, you know, that involves like, you know, a set of principles that we talk about in the full body presence of, you know, first of all, you got to trust that there is support for you, that you are not alone. You are not just there needing to push the wheel up the mountain by yourself every single day without any support, right? That's the first one. And then that you have an innate ability and right to actually feel how, to answer the question every day, what does it feel like to be me today? In here, like, how am I? And take enough time to at least recognize that as you begin your day. I mean, that doesn't have to take a whole lot of time, right? Mm-hmm. Even that very simple, like, dynamic of, like, noticing what it's like for me on the inside to embody how I am. And it might be, I've got a really bad headache. It might be, I'm really tired. But that's just part of me, right? The minute I give that some space, I let myself settle in with that, it's already changed, you know? And then to integrate how we are able to, you know, like a lot of people get really shocked when they first start to dive into like noticing, slowing down. Like they're like, let me bring in another practitioner here that I want to talk about a little bit. Martha Eddy was a colleague of mine in the body-mind centering field, and she is a university professor up in New York. Runs training programs and does research on embodiment and somatic practices. And she has a nonprofit, I think, called Moving into Life that I'll give your readers information about her. But she did a cross-case analysis of somatic movement practices across the various disciplines that are doing somatic work now. And I include CranioSacral. And certainly healing from the core in that realm, even though she didn't in her research. But she says there are commonalities to this embodiment practice that she found amongst all of those, which is that slowing down, you know, like just taking time to notice how does it feel to be me today, to feel the sensation that arises from within. That's really a critical piece of the learning. And then, of course, as everybody probably knows about, like really learning to embody how you breathe. Pay attention and notice your breathing. And then being able to, a somatic practice, being able to notice not just the habitual movements, but what happens when your body engages in movements that are novel or different than just the daily practice of picking up a glass of water and bending around and turning around and sitting down. Like there's a whole range of movement capacities that we don't even pretend to experience. You know, there's flexion, extension, rotation. Those are the primary ones. But what happens when there's like lateral, you know, motion that goes to the side, like dancers involve, and the whole nervous system perks up and pays attention, and you start growing new neuronal nervous system, calming, centering kinds of feelings when your body steps out of the habit. So that's really crucial to growing into this world of somatic experience. And I think PTs could really, if they ever incorporated this whole world of embodiment, that's just ripe field for helping people find their changes, you know?
Yeah, and I don't think that's so common. So that's why I like to bring people to talk about these topics, because I think it's something different that we can just add to our careers. And
well, just to the you know, like in the OT field when I was first studying, I think in the 2 years of my master's training program, I came across one article, one only, on the world of even approaching any kind of somatic individual internal experience. And I'll give your readers this too. Cheryl Mattingly talked about the lived body experience, and that it was the meaning-making capacity of the individual from their internal experience was a modality of practice that was vital to, as important as the biomechanical, basically was her conclusion.
Oh, wow.
I know.
That's huge.
Great article. This was 1990 something or the other. And I was just like, yes, I chose my profession. Just that one article, you know, to kind of anchor me. Yes, the world of OT has room for what I've learned in body, mind centering and CranioSacral therapy, you know. Like, I guess if I have a passion, it's really kind of like, how do I like pull together these things and talk about them? And you're offering that opportunity, so I thank you for that.
That's huge. That's something that smart people should know about it and just be aware. It's not like everybody needs to love it, but being aware and knowing that that is another tool, another skill set that can help us to be more successful. I think that's important.
Yeah, I'll be offering another article by Stephen Porges and Sherry Geller, and their article is on the neurobiological processes for therapeutic presence. It's really, that's a mouthful, but it really is a good research article of their clinical experiences around training and the different aspects of what it is to use the polyvagal theory in practice. And so definitely, you know, there's just, the information is getting out there. But I did want to talk a little bit more about it from a client perspective. Does that sound interesting?
Yeah. I was going to ask about the assessing the power of the vagus nerve, since you were talking about it. If you had something else to mention about this topic.
Yeah, I can talk about that, and then maybe we can do a little bit talking about you know, kind of from a client perspective. Does that sound good?
We have so many things to talk, so go.
I know, there's a lot to go. You know, oh, one more thing I did want to say before we jump to the accessing the healing power of the vagus nerve, is that the other piece that I really work with a lot, and I kind of came to this in CranioSacral, but I think I always came to CranioSacral from the perspective of body, mind, centering. Always. I mean, that work truly changed me in the 4 years that I experienced it. Like, I think I came back from the very first summer, and the people around me went, you're really different. And one thing I noticed was I had been kind of a very linear kind of thinker in some ways. And I always thought I was good at spelling. And I came home that summer from the first summer, and my brain had been so rearranged. Like, every day in class, there was the joke of, OMG, one more mind-blowing, aha, hour after hour. But I came back from that summer, and I literally couldn't spell hardly anything. And it's like my brain, that part of my brain just went offline. I'm not doing that anymore. You have this other material to integrate. It was sort of disconcerting at one level, but ultimately really good for me, I think, you know, getting more right-left brain integration for sure going for me. So anyway, I got a little off track there. We were going to talk about the three-dimensional body. I think that was the piece I was coming to. Okay. Is that my work, I name my practice Body Map Skills. And that for me is a way to say, we need skills to live inside our body in this three-dimensional universe. And this is the work I try to do in terms of somatic education with my clients who come in with problems. And that will lead us to accessing the power of the vagus nerve. Because I use that book to help my clients do this very thing of finding their three-dimensionality. I mean, anytime we get injury or and I know this from personal experience, certainly, injury or dysfunction, the map of how we live in that part of the body if it's there for any length of time, sort of gets distorted, right? So the person is not having an experience a lot of times with that leg fully supporting them. So they, and the system will experience itself normally often as more in front. The awareness of the person is often sort of more in front because it's the social part of us, right? And anytime I can help clients in there with my hands on, or with, if I'm doing distance, kind of doing it that way, but however I get to it, can help a client feel that they have more of the space of who they are to draw on in terms of support. Like if their leg is injured and they can start to go, oh, right, I feel my right leg and my right pelvis, and that left leg feels kind of like it's just kind of dangling in space, or it feels like a fence post, you know? And then you start to bring in what the awareness, the somatic experience of that is like, right? And it can have many, many, many layers. But when people come through that, they often kind of wake up to a whole new paradigm of who they experience themselves to be. Or literally, if you can get somebody who's always in anxiety to even feel their backbone resting on a table. And in that way of safety. It has to happen in the context of safety, or nothing changes in the nervous system. They'll wake up and go, I can't believe I feel this way. I feel more here, I feel bigger, taller, more calm, more organized. And you haven't done a long, mental therapy session. You've really helped them drop into their embodied sense of their self. So the system has more resources to deal and heal and do self-correction for whatever the injury is. And that's the point, I think, in like a PT practice or wherever, that if the therapist does their entire degree of work long enough, sufficiently, they can drop it in these little moments where, you have this information about, well, gosh, maybe if you felt yourself widen out and breathe and feel your backbone and see what happens in your leg, right? Just the simple information. It's like an education, somatic education. Somatics and embodiment is really an education process, both for the therapist who's learning that it's even valuable, for one thing, but two, to help the client to be more self-empowered. And I think that is the tremendous success of the healing from the core work, is that it's all about engaging the empowerment of the client to notice and be the self-director for what the body needs, because they're learning how to listen to it. So, and I use this book, can you see that?
Yeah, accessing the healing power. Yeah, okay.
Yeah, accessing the healing power of the vagus nerve, because it really was, it was written by Stanley Rosenberg with the support of Stephen Porges, the polyvagal theory. And he came to it from a body work standpoint. In fact, his first engagement with Stephen Porges was, I think Porges said he had some sort of, I don't remember the details, but like a lower back dysfunction that the surgeons were telling him he probably would have to have surgery for. Mm-hmm. And when he met Rosenberg said, well, I have some things I can show you that might like really fix that. And sure enough, what he did, I think, was sort of glide the tissue along the disc and the vertebra that were not really created that vertical glide with Porges on his hands and knees, and it whatever background the two of them had together, it came together with a sort of a whole new body awareness for Porges. So he became a really big fan of Stanley Rosenberg. And so Rosenberg's, it's a great primer for anybody who wants to begin to understand how the nervous system and the mind and the body kind of like interrelate for these conditions of safety. I just think it's a great book to begin with. And the last, 30, 40 pages are like individual practices that people can do for themselves. And I teach my clients these things a lot so that they have the tools to kind of bring their nervous system back online, this social engagement system back online, the bringing back in this idea of feeling safe inside one's own skin, then enables you, and having the brain stem cranial nerves as unstressed and in harmony as possible. It allows that to happen. And it's physical. It totally happens on a physical level. You know, like,
That's crazy. I'm impressed by the safety part. I never heard put that way before, that all of that happen, you have to feel safe. So that's interesting new information that I didn't know. Maybe we know unconsciously, but I never heard anyone talking about it. So
in terms of embodiment, you know, and in terms of its role in a therapeutic practice, that it, you know, to me, it is the foundation of what anybody in really in healthcare, but it's not limited to that. You know, it's a human skill set that we all need to be in relationship to each other. Is, you know, noticing when somebody doesn't feel safe, and you know, like there's like, did I write that down? I don't know. We still haven't talked about Taz, so I don't know how we're doing on time.
We can talk about him next.
Okay, yeah, I was going to say there's a whole nother rabbit hole we could go down, but maybe let's just talk about there's so many. I had so much fun trying to figure out, like, so what can we say in a short amount of time?
Yeah, no, but that's been great. It's a lot of good information that people can start going deeper if they're interested on the topics. You're giving the ways, the resources, so people can dig in a little further if they feel like.
Well, that was what I was looking for. Yeah,
no, it's been great. And I know that you want to talk a little bit about TED and the glial cells, fluidity. So
I think that's really important. You know, I think I took his first. It's called Touching the Brain. The glial and the extracellular matrix was the last of his courses, and it has so many echoes for me back into the body mind centering work, you know, and back into because Bonnie talked about the extracellular matrix as an information system, and I think just sort of headline it with the information that the extracellular matrix, right, is that system that exists between cells, right? And it is, let's see, what did I want to say about that? I had to write some of this down because all of this language, I by no means feel that I have mastered this world of glial and extracellular matrix in terms of language and or hands-on. It's an ongoing journey for sure. The extracellular matrix is between cells, and it's how much and quantity is dependent on the tissue layer. Like, for example, it's plentiful in all the connective tissues, like, which we know goes everywhere, right? So you have lots of extracellular matrix. Communication, it's a communication network, but it's more sparse in like the epithelial, the nervous, and the muscle tissue. And its texture changes. Like in the bone, it's very thick and mineralized. In the eye, it's like a transparent gel, this extracellular matrix. But the thing that's so fascinating about it, and I think that's really revolutionary and central to how the training with TAD and the glial work is that that it is the extracellular matrix is like a fishnet. And he describes it like that throughout the whole system that goes through all tissue layers, and that it has kind of a tensegrity, like the wholeness of it. Like you can put your hand here and just rest into, or anywhere, and on top of my head or on my foot or anywhere, and rest into that with that open, you know, you're using Dr. John's neutral presence, listening, hands, so on and so forth. Full body presence, kind of just settling in. You put all that together and you listen in, and the system will show you where there are torsions, deformities, restrictions in the entire network just by listening in. And it's a global information system, and the research out there is that it may deliver faster transmission of information than the central nervous system.
Oh, wow.
I know. And that, you just think about that in terms of how that all fits together. And I think that's really critical for how, let me just say that before we go more into Tad's extracellular matrix, back to Bonnie Cohen and her work with cellular breathing and how that came into my experience, is that in cellular breathing, she literally takes it in that if we drop our consciousness in really to where cellular breathing means inside the cell where the mitochondria are receiving the oxygen, that is internal respiration if you give it a science name. An embodied name for it is literally cellular breathing, that has the capacities for each cell, each and every cell, like the trillions they think that we have, to, in its, each one with its cell membrane is an information system. And that in that cellular network, it expands and condenses, and it has qualities of vibration, and when it gets into communication with other cells, pulsation that we begin to experience when we put our hands on and feel change through that extracellular matrix. So I just wanted to layer that piece in.
Yeah, yeah.
And that what Bonnie says about it is that in terms of the kind of touch and listening from that cellular breathing kind of touch, is that with sort of the more common touch when somebody works with you is brain initiated touch. In other words, the mind of the person is thinking about what they want to find or might find, or how it will affect the treatment plan, or so on and so forth. It's kind of the brain initiated touch, right? With the brain directing the hands. With this embodied or cellular breathing touch, learning to drop back inside oneself and come to it from that felt sensation of, is there expanding, condensing, vibration, or pulsation in my hands? And what does the totality of the system, if you use the extracellular matrix concept of very fast transmission of information, how does it travel through the entire system? And where does it stop? And then you get into like the cranial work, right? Where does it stop? That's always what Dr. Upledger was always asking. Where does it stop? Where are things not moving? And so that's kind of the work. And Bonnie adds the piece of like, when we touch from this embodied place, open place, we much more easily differentiate the qualities, the subtleties, the layers, the tissues, which can only begin with our own kind of embodiment piece. And I think I really took us down a rabbit hole there. What's your next?
No, I was just wondering, so like this is very subtle, all of these feelings and touching. So how do you like develop these skills? You're talking about the extracellular fluid and the breathing. So how do you train yourself, or like how do you feel that? Because
yeah,
I bet that's very, it's hard and very subtle. So how do you do that?
Well, there are a lot of avenues, honestly. I think honestly a good craniosacral training program develops probably about 80% of that. Because you really, and if you can take the developing and deepening your craniosacral presence, you're going to get there faster. Like most practitioners will say, it took me 5 years. I could take the classes in a year or two, but it took me 5 years on my own, practicing on a regular basis to really feel like I could listen at that level. So it doesn't have to take that long. So developing and deepening your cranial sacral presence can take you there. Any of the healing from the core training, we're in an interesting dynamic there of like distance and not hands-on. I mean, all of that work originally happened in person. So you got that experience of training and feeling and moving and breathing, and some of it still goes on. We're just in with the distance work, you can feel it in yourself. Like I just took one of the advanced cranial courses that was developed with Dr. Upledger and Tim Hutton, and actually Suzanne Scurlock had some help in that program as well, and teaches it CranioSacral in the immune system, where we did it online and could begin to feel the craniosacral rhythm in the layers of the immune system and in the different tissue layers where the immune system lives. Now,
That's crazy.
It was crazy. I mean, it was a stretch for me, honestly, I have to admit. Like I'm going, okay, I'm here by myself. I'm feeling under my skin. What am I noticing? And I've got a lot of experience with this, right? So,
Yeah.
But I did not hear anybody who took that course complaining that they could feel nothing, right? But there are people who come to it, or you have clients who come in and they don't have this experience of being able to feel in their body. So things have to go down to the basics, which the full body presence healing from the core really do. It's a great training program for going into the basics of how to listen and how to drop in. So I would put that one really like right up on the top of my list. And not just because I'm involved in it, but it truly is a remarkable program. And then the training in body, mind centering is ongoing. There's like, you can, like even if I just sit here and shift and settle back in and feel myself, like we have such capacity to use mirror neurons to learn from each other through all those subtle social engagement avenues that we talked about earlier, I mean, what we know is that modeling is like one of the fastest highways in the body for the brain through the mirror neurons. So people learn from each other how to do this. And just the being able to know it exists, have a paradigm for knowing that this is possible, because as most of us as little kids really understood what it was like. If you have a little kid, they don't go around thinking about embodiment, right? They just are alive and joyous or upset and crying, it's all right there. And as we get conditioned into different parts of our nervous system by our training, by our culture, so on and so forth, we sort of lose touch with the more autonomic, spontaneous, joyful, alive aspect of beingness, right?
Yeah.
But, it's like, and people come to some aspects of it through meditation or yoga or Tai Chi or, dance or movement or prayer or meditation. I mean, all of that takes us into that territory, honestly.
I think the challenge for, I would say, for most of us or PTs, I used to manipulate, put the hands on, everything is more, I don't know, strong, the approach, you want to fix it, you want to do it. I think most people probably wouldn't have the patience, the calm to try to feel of that. So I think that's the challenge, because that's what you learn on college, right? That's how
you're trained.
Yeah, you are trained that way. You are not trained to feel like these subtle, how do you say, the sensations, this light touch and all of that. So I think that's the challenge, and probably that's why many people don't hear about it or are not interested about it, or it's not like a big part of the culture. So I think that's something interesting that I had a little training CranioSacral, but it was very little. It was like a weekend, so I can't say anything. But I had some contact and some experience, so I understand better what you're saying. I don't have that experience in depth, but I imagine most of PTs here have never had this experience before. So I bet that's challenging.
It is, and I totally agree. What happens though is that if what you do as a PT in that sort of quick fix, and give somebody like the education to move differently, helps them, then great, it's done. You're good. The person doesn't come back, right? They're off on their own, they're good. And a lot of times that works. And the different layers aren't as the different layers aren't as necessary. But then there are people who don't get better, the chronic conditions, the situations where things just, like I had a client recently, and this is not the first time, who came in and she got in at least for 1 or 2 sessions before I had to, shut down for a while for COVID, right? But she came in and she had originally fallen and broken her distal radius. I think that was the bone she broke. And they casted her, full forearm cast for all of that. And she said, I just knew the cast wasn't right? It didn't fit right, it was uncomfortable, so on and so forth. Well, when they finally got her out of it, she had some very severe, not exactly contractures, but her wrist bones weren't like, she had sort of humped wrist bones, and all the tendons in her hand were like ropey. And then it went on to develop into like pain that wasn't resolving, and stiffness that where she couldn't bend her fingers. And she's a musician. So,
oh, wow.
So she went down the route, and she started to develop skin changes. Like her skin began to get like really shiny, and her whole nervous system, she said, felt like it was engaged. Now she's a bright woman. So the PT department took her as far as they could and said, it's just going to take time. That was basically what she was given at that point. Because you've done everything that we have here. And so she researched on her own and came up with the idea that she probably had complex regional pain syndrome. And that's when she shows up and contacts me. And so when you come to a problem that isn't getting solved, there's the need for another approach. And so I really just sort of use the TAD1 VIRS, extracellular matrix, and kind of listening into her system to see where her arm was feeling connected and where it wasn't, into that fluid flow in her system. And really it was listening, that whole piece of just listening where the tissue took me. And it just felt like her superficial lymph even wasn't able to make that transmission back into the superior vena cava from that arm. And even at the level of the tendons in her fingers, which were swollen and ropey. Very dense and ropey feeling at that point. With one session, just this gentle listening session, kind of if you were using Upledger language, it would be like unwinding, right? But it was much more subtle than that. It was like listening to the whole glial extracellular matrix progression through her right arm, into all the different layers and muscles and pathways that it wanted to take. Because of course when you begin working in this way, you actually don't know. I mean, you have your basic skill set of knowing how the body generally works, but you don't know what that particular system needs. You have to really slow down and be completely open, which is that neutral, to what the system is going to do. So she has recovered quite a bit with she can fold her hand now, at which she could only get about halfway in terms of flexing her fingers. Now she has full flexion, and her hand is definitely, she says there are days when I don't actually notice what I can't do anymore. So we're pretty excited about that. But I think PTs who when you work long enough, you begin to recognize where what you know isn't going to take people, and that's when people start to look, I think.
Yeah. I think we are missing part of that, like we are missing our jobs, we are lacking that. And I think it's important because we can fix everybody, we can help everybody. And there are a lot of these people that we can help. And I think having that skill set would greatly increase the number of people that we can help, because there's things that are simple we can treat and people are going to be fine, but there are more complex cases that we don't have the ability to help. So I think that's the interesting point.
Yeah, I think that's where this work really comes in, is
Yeah.
when people don't fit into that sort of simplistic.
Yeah. I think we talked like pretty much about the main topics that we prepared. Do you have anything else to add to wrap up? So we can go to the final questions, or like, do you have anything else that you want to talk or add?
The only thing about that embodiment piece I think I made a note of, I wanted to say, was that when the therapist actually spends some time on this embodiment practice business, that you get some outcomes for all your clients, not just the difficult ones that take a lot of time and more patience and more slow down time, but you yourself have an improved empathy to better understand what your clients are saying when you come to a sense. And it actually gives you better diagnostic touch skills because of being able to perceive the layers, even in the most simple cases. And you also sort of come into that, the whole topic of ethics of intention and conversation with clients who are vulnerable is like another whole topic altogether. So, but you develop a really enhanced system of how not to prognosticate or predict outcome, holding better boundaries, I guess I want to say, for clients when you have this other level of understanding. And any and all of that can lead to simple, better clinical decision making about how to work with your clients. And for the therapists themselves, this whole embodiment model really prevents burnout, and keeps people back engaged. The class I taught back in February up in Detroit, I had one young, 30-ish PT. She was ready to give up her career because she was so frustrated. And she left feeling so much more energized and hopeful that she could integrate enough of this work into her fast-paced clinic that she would feel like she could continue her career. So that would be my hope, that, we don't lose people due to burnout.
I bet many PTs feel that way. It's
easy to do.
Yeah.
So I think we've kind of covered the basics. If you want.
Good. So let's transition to the final questions. So the question will be your favorite resource of information, and you've been talking about books and articles throughout our conversation. Do you have something else that you want to add as like a resource of information?
Well, I read. I'm from a generation where podcasts didn't exist, of course. But I'm getting more familiar and comfortable with the podcast format.
Nice.
Yeah, it's like I'm neuroplasticity for me too, right? That would be a good book title, right? Neuroplasticity for me too. But for me, really, direct experience is always the best source of information. And I know that from any of the multitudes of classes I've taken, is like whatever I take in and experience and have a sense of in my own body and in my own self becomes what I'm able to use. So that's my best source of information, is that somatic awareness within myself. Being an open system to what comes in and being able to, take in and use and integrate. So direct experience.
Nice. So the second question is, what would be the best advice you can give to clinicians that are starting their careers?
Well, what I've been talking about really is engage in embodiment practices for yourself. Just really anchor in that knowing. And there's research out there, like the Porges articles on therapeutic presence. Anchor in that knowing that you, as a therapist, as a human being, as a sensitive and caring human being is the best resource for your clients. And when you put that into the equation, then your knowledge, all that you've worked so hard to learn and study and incorporate, can be received by your clients if they feel safe in you, in your presence as a human being, and that you are listening to them. Otherwise, it just kind of doesn't go in. And I think that's probably the biggest aha that I would offer for people.
That would be a good practice for all of us,
Yeah.
actually. Yeah. And what personal qualities or abilities that you think are important to be a successful professional?
Again, whether you are hands-on or other, it's that developing the listening skills, and if you're hands-on, listening hands, and trying to discover what that neutral therapeutic presence and letting the body listening from that sort of open, not brain-directed state feels like. Like it's a paradigm shift, literally a paradigm shift of who I am as a human being, to come from my body experience of what my hands are showing my brain versus what my brain is delivering and looking for so that my hands can do it. I would say however you come to that skill set through the various ways I've talked about, or the hundreds of others that are out there.
Yeah.
I think that, when I see a practitioner myself, I'm pretty highly sensitive to if they're directing my body from their brain or if they're listening to me. So there are stories to be told.
Yeah. And I think that's quite challenging, because when we go to approach a patient, usually we know what to expect. You know what you are testing. So I think it's very different from that approach. And I think it makes total sense what you just said, because we kind of are induced to find something and not just pay attention and listening and feel it. So I think that's very interesting.
Well, it's really multitasking, right? Because you want to be able to use all that information. You want to receive that information, right? And use it, because your knowledge is important. But
yeah.
Anyway, I really...
It's interesting. No, I really appreciate our conversation. A lot of interesting things, points that you touched that I haven't heard before, and I think it makes total sense. So I'm very happy to have you here and to learn all of this new information and bring awareness to all the other therapists that are listening to us. So I think that's our goal.
Yeah, well, I love the work you're doing, and I look forward to more podcasts.
Yeah, sure. And if people want to contact you, do you have any contact information that you can leave here? I don't know, maybe an email or...
Yeah, my email is always available, and I have a website, Body Map Skills, but which is woefully out of date, so please excuse. But the email address is Joanna, my name, Joanna, at bodymapskills.com.
Okay, great. I'm going to put all of that on the notes so people can have access, and if they want to know more about it or they have interest in reaching out to you, they know how to find you. Thank you so much, Joanna. I really appreciate you being here and sharing all this knowledge and experience with us. Really appreciate it.
My pleasure.